Hello folks, I'm Roger Blumenthal, Professor of Medicine here at Johns Hopkins, and I'm very pleased to be with one of my good friend and colleagues and favorite tennis partner, Dr. Ron Berger, also Professor of Medicine here at Hopkins, and we're really pleased to have Ron here to talk about optimizing therapy choices to prevent stroke in patients with atrial fibrillation. Is there any role for other antiplatelet agents, prasugrel, clopidogrel?
Yes, these drugs have been tested in clinical trials, and in general, antiplatelet drugs are not as effective in preventing stroke in patients who have atrial fibrillation and risk factors as are the true oral anticoagulants. These drugs have been tested in particular against warfarin. In a clinical trial, the ACTIVE-W trial, aspirin alone and even aspirin in combination with clopidogrel was not as effective at preventing stroke as administration with warfarin. So where there's a role for platelet inhibitors is, as I said, aspirin in the lower risk patients. And then in patients who have an indication for platelet inhibitor, for instance, those with peripheral vascular disease, coronary artery disease, and particularly those who have received a stent, the platelet inhibitors, of course, are indicated and should be used, in fact, with some caution when an oral anticoagulant is co-administered for stroke prevention in patients with atrial fibrillation and risk factors.